Oppositional defiant disorder isn't just for kids. For adults, it's a daily battle that impacts everything. The biggest challenge? Adult ODD is frequently missed, often mistaken for a difficult personality or another condition. It looks like a constant struggle with authority, a short fuse, and persistent negativity that strains relationships. Without the right tools, it feels like an unbreakable cycle. We'll show you the path forward, built on two powerful pillars: cognitive behavioral therapy and strategic self-care. First, CBT. It's a structured therapy that helps you see the direct link between your thoughts, your emotions, and your actions. So how does changing thoughts change defiant behaviors? It targets the automatic, unhealthy thinking that fuels ODD. With CBT, you learn to rewire those negative thought loops and drastically improve your anger management. It also builds practical problem-solving and communication skills that may have been underdeveloped. But therapy is not the whole story. The second pillar is strategic self-care, which creates the foundation for CBT to work. This means targeted practices like mindfulness that directly improve your ability to regulate intense emotions like frustration. So how does this work? In CBT, a key goal is identifying your triggers. What situations or words reliably precede an outburst? Once a trigger is seen, CBT teaches cognitive reframing, catching a negative thought like, "I'm being disrespected," and challenging it. By changing the thought to "my boss is stressed," you short-circuit the automatic anger and create space between trigger and reaction. But what happens when the emotional storm is too strong? When thoughts are too overwhelming to reframe in the moment? This is where mindfulness comes in. You don't stop thoughts. You observe them, letting the wave of anger pass without being swept away. So CBT gives you tools to rebuild your reactions, while mindfulness gives you the mental space to actually use those tools. Consider a workplace scenario. An adult with ODD may be persistently argumentative and react poorly to constructive feedback. Using CBT, that person learns to recognize the physical signs of rising anger: a tight chest, clenched fists, as a signal to act. A self-care strategy is a structured routine, practicing deep breathing for 5 minutes before a triggering weekly meeting. In relationships, family members can learn to offer choices instead of commands, de-escalating conflicts by respecting autonomy. These strategies are proven. So why can managing ODD still feel like such an uphill battle? The answer lies in what coexists with it. Here's a critical fact. An estimated 40 to 50% of adults with ADHD also have ODD, creating immense challenges. A childhood history of ODD also significantly increases the risk for developing bipolar disorder, anxiety, and substance use disorders. Remember our question about overwhelming thoughts? Co-occurring conditions are often why. The mind is already racing, making CBT difficult. Because of this, other therapies like DBT, which focus on both acceptance and change, can also be highly beneficial for some. It seems complicated, but this is where the two pillars, CBT and self-care, truly lock together. Let's synthesize how. Think back to the workplace. The challenge isn't just the difficult feedback, it's the feedback combined with underlying anxiety. Here is the key insight. Self-care manages the static from comorbidities. It calms the system enough for CBT skills to work. One pillar provides the blueprint for change, which is CBT. The other builds the foundation to support it, which is self-care. The goal isn't a cure, but to build a personalized management system. So what does this mean for you right now? We've seen that adult ODD is a complex, often misunderstood condition. But the combination of CBT and self-care offers a proven path. This integrated approach leads to better emotional regulation, healthier relationships, and a profound sense of regaining control. A diagnosis is not a definition of who you are. It's a starting point for understanding and building a better future. If this is your situation, take the next step. Talk to a mental health professional about CBT and start one small self-care habit today.